Okay, I see that.
All right. Thank you, doctor.
Okay, so over the next 1 hour, we'll try to cover the kidneys. The lecture says gross anatomy of the kidney. Okay, so we'll start. So these are some of the functions of the kidney. Okay, let me just take the point. Okay, so the some of the functions of the kidney are as follows. So it filters nitrogenous waste here, okay, toxins, iron, and so on, from blood to the urine or through the urine. Another function of the kidney is that it regulates volume and chemical composition of blood. Okay, so it's not a composition include water, salt, acid, bases. It also has some endocrine function. It produces regulatory enzymes like renin, which takes part in the regulation of blood pressure and also kidney function. It also pulls another hormone called erythropoietin, which is important in red blood cell production from the bone marrow or in the bone marrow. It also takes part in metabolism of vitamin D, and so on. So the kidney has so many functions. Okay. Basically, each person has 2 kidneys. Of course, each kidney is drained. The urine produced in the kidneys is drained into the urinary bladder through the ureter. So there is 1 ureter from each kidney, goes down to link up with the urinary bladder. We also have, of course, the bladder that holds the urine until excretion. And the urine excretion is through the urethra. Okay. So this is just to complete the description of the urinary system. Now, if you take a transverse section of the human body at the level of the kidney, at the level of L2 vertebra here, vertebral colon, lumbar vertebra number 2, this is what we see. We see that the 2 kidneys are on both sides of the vertebral column. Okay, and anterior to that, this is the abdominal cavity here, and this is the anterior abdominal wall. Okay. If I may ask you, where is the right kidney now? Which one is the right kidney? Which one is the left kidney? How do you know which one is the left kidney? Which one is the right kidney? Hello, I'm asking you, please.
Usually we look at it from the front. I don't know how to explain it really, sir.
No, explain whatever. Explain how you just explain.
Well, usually the right is the when we look at the organs, it's the opposite, I guess, if that makes sense. So the right the right kidney is usually when we look at it, it's the left kidney, I guess.
No. I want you to look at the structures, all the structures on the figure now. Look at them,
yeah,
and use them to know which to identify which is the right kidney and which is the left kidney.
The right kidney is the, how do I say this? The aorta, renal artery, and yeah, that part.
No. What I'm asking to do is this. If you take a normal, in a normal anatomy, in the abdomen we have aorta and inferior vena cava. Okay, the aorta gives rise to renal artery which supplies the two kidneys. We have right renal artery and left renal artery going to right kidney and left kidney respectively. And we also have veins that drain from the kidneys to the inferior vena cava. So what I'm asking you is, in relation to aorta and inferior vena cava, where is the right kidney and left kidney? Because you can see the abdominal aorta here. This is abdominal aorta here. This is inferior vena cava here. So what? Okay, first of all, you need to identify from what level am I looking at this diagram or this cadaver? Am I looking, because this is a cross section? Okay, this is a horizontal section or transverse section. So you want to ask yourself, am I looking at this picture from below the patient or the cadaver or above the cadaver? You can look from above, you can look from below. Okay? Is everybody following?
Yes.
So if I ask you now, which is the right kidney now? You can
The
see
right-
the aorta there, isn't it?
Yeah.
The right kidney is the one next to the aorta because this is the transverse section, and then the anterior region is above, and then the posterior region is below.
So who has other opinion? Who has different opinion or understanding? Anybody, please talk, okay?
No, that's what I answered just now. I do
No,
agree.
not you. Other student. I want other students to contribute. Other student, are you there?
Yes, doctor.
Yes,
We
doctor.
with
Oh, I'm talking to ghosts. Maybe you're at home just relaxing, not listening to me. I'm asking you, I said, which is the right kidney, which is the left kidney here?
I agree with Raman just now. The renal.
Okay, who doesn't agree with him? Anybody who doesn't agree with him? Anyone who doesn't agree with him? All of you now agree with him. How many are you here now? 70 students. You all agreed with him from your homes.
Yes, we agree.
That's very dangerous because you have all failed. Okay, you have all failed. Okay, I will show you another diagram now. Now look at this diagram now. You are looking at the patient from behind, from the posterior part. Okay. So where is the right kidney? Where is the left kidney now? You are guided. You are looking from behind, from posterior. Which one is the right kidney? Which one is the left kidney?
Right kidney is the lower kidney.
Huh? Which
Right
one is the
kidney,
right?
the lower kidney.
Okay. I know what okay. What do you mean by? Okay, in relation to what is this blue structure here?
The inferior vena cava,
What are this structure here?
the aorta.
Do you believe this is how they are arranged? Do you know that the inferior vena cava is on the right of the aorta and the aorta is on the left of the inferior vena cava? Do you know that? Do you know that that's how the structures are? That's how they are. So if you are looking from posterior, that means this is the right side, okay? And this is the left side. So this is the right kidney. This is the left kidney here. So you can see the inferior, the inferior vena cava is closer to the right kidney. The aorta is closer to the left kidney. Isn't it? So you can see the aorta gives rise to left renal artery, which is short because it's closer to it. For the aorta to supply the right kidney, you can see the right kidney, so the right renal artery is very long. You see, it's long because the right kidney is far away from the aorta. The same thing, or the opposite is the case. The right renal vein is short because the inferior vena cava is very close to the right kidney. So the vein that drains the kidney is short because it travels small distance and then it reaches the inferior vena cava and drains into it. And the same thing, I mean, the vice versa here. For the left kidney to drain blood, deoxygenated blood into the inferior vena cava, it has to reach, I mean, it has to cover significant distance because it's far away, so it is there. Now, before we leave this diagram, even though it's not AP, I mean, it's not anterior view, look at what happened. The left kidney, the left renal vein, the vein that drains the left kidney is called the left renal vein. Look at the left renal vein, it has to pass anterior to the aorta to reach inferior vena cava. Why? Because the aorta is on the posterior abdominal wall, okay? The aorta is attached to the posterior abdominal wall, not attached, but it's adherent, it's touching the posterior abdominal wall. So the vein cannot pass posterior to the aorta. So it passes anterior to the aorta. Okay? So that is one clue that can help you. If you go back to that diagram I just showed you now. If we go back to this diagram here, where is the diagram? This one here. So look at what we just saw. Now, we were looking at that previous slide, figure just now from posterior here. And the cadaver was standing. And we was looking at the kidney from behind, we could see. This is the vertebral column, this is the spinal cord here, this is the body of the vertebral elbow. So this was the right kidney we were looking at. This is the right kidney we were just looking at now. Okay? And this is the left kidney. Now, what I want you to know is that this cadaver now, we are looking at it from below. After the cadaver was transected transversely, to take the picture of the structure, I told you we have two options. We can keep it below and then put the camera from above and take the picture. We can also put it up and take picture from below. So this picture was taken from below the cadaver. This picture was taken towards the lower limbs of the cadaver. That's what I'm saying, towards the distal part of the cadaver, so that this is the right kidney. Okay, because this inferior vena cava is close to the kidney, so this must be the right kidney. So if next time you are asked this kind of question, just refer to inferior vena cava and aorta. Any kidney you see close inferior vena cava, that must be the right kidney. And all you need to know, or all you need to do is, just imagine, is this picture from above or from below? If you cannot deduce that, just know that anywhere you see a kidney, and you see aorta there, that must be the left kidney. Okay, so that's just the simple what I can tell you now. Of course, as I told you, remember the inferior vena cava is on the right side. So for the left kidney to drain this deoxygenated blood, the left renal vein has to travel. You see, it passes anterior to the aorta. You see, it passes, so that's one landmark. That's another clue that can help you. Once you see a vein passing anterior to the aorta, you know that most likely this is the left kidney. Okay, so these are some of the features you can use. Okay, so very important. Now, before we leave here, you should also see that the kidney is covered in a capsule. So the kidney, the outer part is covered in connective tissue capsule. Then after that, then the kidney where it is located is covered with a lot of fat. Adipose tissue, see, adipose tissue. Okay, after the adipose tissue, then we have renal fascia. Look at it here, renal fascia. So this is the renal fascia, this one here. So the renal fascia, you see, this is the one, is the same thing. And if you look, kidney has no attach, it's not attached to anything except this blood vessel here. So that means the kidney is floating, actually. It's floating, it's moving. I mean, it's really moving. Only thing holding it is this part. And maybe the fascia anchoring to the fat here. And this is why if somebody loses weight so fast, some people lose weight, 30% of their body weight in 2 months' time, then they'll become very, very slim. If somebody does that, the kidney can go down. The level of the kidney here, if you lose too much weight, because it's not, what is holding is fat. If you burn your fat very fast or too fast, then the kidney can go down. So you see the level it is here, it can, this upper pole can reach here. This one here also can go down here. And that is bad, because you know what happened? The ureter can bend, can kink. You know, kinking means it will bend, and when it bends, the urine will not pass properly. It's just like you have a tube, watering tube, you know, the one that you fix with the tap water, and then you either wash car or you do gardening. So if the sometimes you see those tubes, they are king because it's long, and the water will stop coming. Okay. So that's it. So the kidneys, I mean, those are the structures covering the kidney. Okay, so let's move on. So I've told you this one now: renal capsule, adipose tissue, and renal fascia here. Okay, so this one is anterior abdominal. So we move on. Okay, so this one is just to show you that right kidney is inferior to the left kidney. Amar mentioned that. Okay. So now, do you know why? Can anybody tell us why is the left kidney so right kidney lower?
Due to the liver.
Yes, due to the liver, the presence of liver here. So the liver is very big. You remember I told you liver is quite big. So it covers big surface there. So it took over this, and so if the kidney wants to go up, cannot. So it goes down. So look at the kidney. Also has adrenal gland. This is the adrenal gland. This is the left adrenal, right adrenal gland, sorry, and left adrenal. And the two glands have different shapes. Okay, that of the left side, you see, it looks pyramidal in shape, triangular with apex. While this one looks quadrangular. Anyhow, we're not discussing that one now. Okay, so this is the same thing. Okay, the same thing. So now how do we estimate the levels of each kidney? So you can see the left kidney, we say it's higher. This is T12 vertebral column number 12. This is 11. This is L1, lumbar vertebral number 1, L2, L3, L4, L5. So you can see the left kidney extends from intervertebral discs between T11 and T12, okay, until L2, lower part of L2. This L2 here. That is the extent of the left kidney. What of the right? The right starts from the intervertebral between T12 and L1. Okay, here. Okay, and you see it goes until it reaches almost the lower part of L3. So it's extend from intervertebral is between T12 L1, and then goes until it reaches here. So they are at different levels, but look at their ureters there, like, okay. And we say kidney is retroperitoneal, means it lies posterior to the in the posterior abdominal wall. It's covered by the peritoneum. There are structures that are within the abdomen, as I told you last time, like the stomach, the liver, the small intestine. You know, all these are intra-abdominal because they are within the abdominal. But some are not in the abdominal cavity, like the kidneys, the pancreas, the ureters, and many other some other structures. Okay, kidney on average is about 12 centimeters by 6 centimeters by 3 centimeters. And on average, it weighs about 150 grams. And these are the covering I mentioned to you. It's covered by renal capsule, adipose capsule, and renal fascia. Okay, so I mentioned all this. Now, if you take kidney and remove all the structures attached to the kidney, blood vessels, nerves, connective tissue, and you make it naked, this is how it looks like. It looks like a C. Okay, it looks like a C. Okay, this one was also, in addition to that, it's also cut to show the internal structures. So this is the, sorry, I'm moving off my chairs. Okay, so this is the, how the kidney looks like. You can see it has a gate, okay? This one is a gate. The gate of the kidney or the entrance of the kidney is called hilum. And I told you we remove all the structures, so there is a cavity inside. That cavity is called renal sinus. And you can see the main tissue of the kidney is divided into outer peripheral part called cortex and the inner part called medulla. Okay, so the medulla. Okay, I think we'll go to the next. So you please get this one. The liver also has hilum. It's called porta hepatis. The lungs also have hilum. We call them hilum. I think, yeah, hilum of the lung. Another name for it is hilus. You can call it hilus. You can remove M here and put it S. What is allowed in the nomenclature. So if you put back the structures, or you take a kidney with all the structure inside, this is how it looks like. So look at here. This is the area we call hilum, isn't it? We just call it hilum. So there are structures going in and coming out. Those going in are in artery here. Artery, this is the renal artery and its segmental branch. The branches that is supposed to give, they are called segmental branches. I'll discuss more about them a bit later. And then you can see veins are coming out, okay? Veins are coming out to multiple veins. You see, tributaries are coming to join to form the renal vein. And look at them together, there's also a renal pelvis. This is the beginning of the aorta, funnel shape. And you see here, we have calyces. The bigger one are called major calyces, the smaller one are called minor calyces. Now looking at the parenchyma, if we say parenchyma, with the tissue of the kidney critically, you see that it's divided into lighter areas, peripheral lighter, and also that go inside. And then there is also, what do you call it? Darker structures, dark brownish, this one here, this one. They look like a cone. They look pyramidal. This is the apex of the pyramid, this is the base of the pyramid. So this is the whole of this structure here, where the kidney, inner part of the kidney is medulla. So inside medulla, what is spectacular is the presence of pyramid. Okay, they are called renal pyramid. Look at here, renal pyramid. So we can say they are pyramidal shape or cone shape. Okay, and they are within the medulla. And look at what happened. They are separated by tissue that is coming from the cortex. So you see the cortex, this is how the cortex look like. Okay, it is light and granular. But look at the tissue that separates this pyramid in the medulla. So it's the same tissue actually. Okay, it's the same tissue from the cortex. Okay, that's why we call them medullary rays, but we know it's a cortical tissue that goes separate. So in the medulla is made of the pyramid and this tissue. Okay, intermedullary tissue. Okay, and at the apex of the medulla, you can see we have minor calyces here. This is the drainage system. The urine that is produced in each of these has to be drained. So it's organized into smaller minor calyces, okay, which receive the urine. All the urine from one unit of pyramid is received by the funnel-shaped minor calyx. So multiple minor, 3 to 5 minor calyces, okay, join to form one major calyx. And all the major calyces, they join to form the renal pelvis. And the renal pelvis is the upper part of the ureter. So the lower part joins the main ureter. So that means all the urine are conveniently drained. Okay, are conveniently drained. And if you look at the pyramid, you see that I say it has apex, which is received by the minor calyces, and it has a base. The base is on the cortex here. Are we together, all of us? Are we together? Is it clear?
Yes, doctor.
Yes, doctor.
Okay, so I go to the next slide. Oh, I think we have, before this, maybe I'll teach you one more. Okay, so I've mentioned all these renal, minor calyces, major calyces. I have mentioned this one. Okay, I have to teach you this one before the detail, before the histology. So you remember in the liver we say we have right lobe, left lobe, and then each lobe you open, you have lobes. Do you remember that?
Yeah.
Okay, you have to remember. So there wasn't confusion. The only thing I told you last time is that the left lobe of the liver is bigger than the right, internally, okay, structurally, but grossly we saw that the right lobe looks bigger because we're just using pulse ligament to divide the liver. But when you enter in the architecture of the liver, you find that the left lobe is bigger, okay? Maybe you only reach here too, or if I have time one time, I can explain to you what happens. Okay, now in the case of kidney, it's not the same. If you go to the lungs, I haven't taught you the lungs yet. If you go to the lung, we have right and left lung. Do you know that the left lung has, what do you call it? Has the same number of lobes Okay. Sorry, has the same number of lobes as the right. The right is divided into superior lobe, middle lobe, and inferior lobe. The superior lobe of the left, while on the case of the left lung, it has superior lobe and inferior lobe. Okay, but the number of lobes is the same. And anyhow, what I'm trying to mention to you is that in the case of kidney, is different arrangement. In the case of lung, you just take one lung and inside you divide it into lobes and lobus. Very simple. In the case of kidney, it's not that like that. Okay, the same thing with the liver. You just take one lobe, divide it into lobus, no problem. But here is different arrangement. So I'm going to explain to you what happened here. Okay. So can everybody see this diagram? So if you take individual pyramid here, you see each pyramid you take one pyramid, another pyramid. Remember, we said that the area, this inner part, until you reach this sinus. The sinus is the inner cavity containing fat. You see, containing fat, containing minor calyces, containing blood vessel and veins, containing nerve. All this is the sinus, the inner cavity of the kidney. So we are saying that from this edge here until you reach the cortex is medulla. And we say medulla is not uniform. It has pyramids, and in between it has there is cortical tissue called medullary rays. Okay, so if you want to define what is a lobe in the kidney, we take one pyramid. Okay, look at here. We take one pyramid. We take in between pyramid we have cortex. We have cortical tissue, which is called renal medullary rays. So you divide it into two. You take half of that tissue, add to this pyramid. You come to this one here between this pyramid. Again, this is the index pyramid, the one we are talking about now. You take the half of this tissue also between this pyramid and this one, and add to this because it belongs to this one here. And then you go to the base, its base, and take all the cortical tissue at the base of this pyramid. If you add all this cortical, that means you are just adding cortical tissue around this pyramid. Now, if you do that, this area now is the renal lobe. Okay, it's one renal lobe. Are you following?
Yep.
Yes,
So
doctor.
that means one kidney has multiple lobes. So the same thing, you can do the same thing here. You can do the same thing here. You can do the same thing here. The same thing, the same thing, the same thing. So when you are asked, describe the renal lobe, don't describe it just like what happened in the lungs and in the liver. No, this one is different. Okay, you have to first of all define what is a cortex, what is a medulla, and then describe in the medulla. This is how it is. The tissue is arranged. There is it's how do you call it? It's divided into pyramids, multiple pyramids, and in between pyramid we have extension of the cortical tissue, and it's called medullary rays. And you say to define a lobe in the kidney, you take one pyramid and take adjacent, all the adjacent cortical tissue. That between here and this pyramid, this one and this pyramid, and at the base. And if you add to this pyramid, now you have one renal lobe. Okay, I hope it's clear. I'm moving to the next stuff. What about renal lobule now? Renal lobule. What is renal lobule? Can anybody explain what is renal lobule? I've explained to you what is the renal lobe. What is the renal lobe?
The part of a renal lobule. I mean, a renal lobe.
No, you see, that's another thing. Okay, anybody? No. So the renal lobule also different again. Can anybody explain to us what is renal lobule? So we have just seen now, in the case of kidney, you don't just take one kidney and divide it, structurally and say, it is made of, no, it's not like that. It's not, you need to do this arrangement we just mentioned. How about renal lobule? Do you take one lobe and divide it into smaller compartments or smaller structures and call it renal lobule? Anybody, please? 70 students from home.
Is it the nephron? Like something to do with the nephron?
Yeah. So how? Can you go further and explain more?
It's in the cortex and it includes the collecting duct as well.
Yeah, good. Who's this? Who's talking? Let me see. Who are you?
Patricia.
What is your name?
Patricia.
Oh, Patricia. Patricia, isn't it?
Yeah.
Oh, great. Good, good. You tried. Excellent. So she got it, okay? So if you want to describe renal lobule, okay? Now to describe renal lobule, you have to describe the blood supply to the kidney. Okay, to get it very clear. So that's why I would quickly explain to you blood supply to kidney. Now you remember we mentioned that the right kidney, sorry, I don't know where it's like coming from. This is a renal artery here. It passes through the hilum, you remember? Then enter the sinus. It's not the only structure, there are so many structures in the sinus, but this the artery divides into segmental artery. So that's what you wrote here. Aorta give rise to renal artery give rise to segmental arteries. Okay, so these are segmental artery, all the branches here. This segmental artery, they come interlobar. They pass between the lobes. Now you know where the lobes are, isn't it? So as they pass between one lobe and the next one, they are called interlobar artery. Okay, and remember, now look at here. This is one lobe here. This is another lobe here. Another lobe. So as they pass through, they will reach a junction between the cortex and medulla. The junction between cortex and medulla is called cortico-medullary junction. Very simple, from cortex to medulla. Medulla, not a medullo-cortical junction. We don't call it like that. We said cortico-medullary junction. Okay. So when the interlobar, okay, interlobar artery reaches here, you see it curves. At the junction between the cortex and medulla, it curves. You see, they curve. They curve, okay, they curve. Those arteries, those branches that curve, they are called arcuate, okay, here. Arcuate arteries. Arcuate, okay, because they are making arcs. Okay. Now look at what happened. From those arcuate arteries, some branches arises here. So those arteries here, we call the most of them, some of them can be called cortical radiate arteries. You see all these arteries that are rising into, they are going into the cortex straight. Okay. So these arteries, they go like this, okay? And they supply the cortex. So that's how it happens. Now look at what happened. From those cortical arteries, some books will call these arteries interlobular, okay? But you can just call them what we put here. Okay. So from those arteries here, cortical radiate arteries, you can see they have branches. They branch into multiple. All those the red ones, they are the arteries, okay? They are the cortical radiate arteries. So you can see they give rise to multiple branches. Those branches are afferent arterioles. Afferent going to the individual nephrons. Okay. So look at what happened. Okay, here we take only one pyramid here. Okay, can everybody see?
Yep.
So if you take now, do you know what is this one here now? The whole of this structure is one lobe. Okay, please. One lobe. Sorry, one lobe. Okay, so this is one lobe because this is one pyramid with surrounding cortex on both sides and the part of the base, part of the cortex here at the base. So this is one lobe. Okay. Now look at what happened. We said the arcuate, these are the interlobar artery and vein, and here they become arcuate arteries. From the arcuate arteries, actually this artery, you can call it interlobular. But we want to arrive at the lobule. So what is a lobule? If you take one interlobular artery, okay, one interlobular artery, and all the afferent arterioles it gives, together with the tissue, together with the cortex, together with the nephron it supplies, and connective tissue. All the tissue around there, from around one interlobular, with what is all is supply is called lobule, one lobule of the kidney. So what lobules, structurally lobules are located in the cortex. Very important. The lobules are located in the cortex. Okay, while the lobes span the medulla and cortex. Are you following, please?
Yes,
Yeah.
doctor.
Yes, doctor.
Very important to know this. So when you talk of lobules of the kidney, you have to describe the blood supply up to the terminal branches from the renal artery and up to the afferent arterioles and all the nephron around there, including connective tissue. That's one lobule. And you can see like this lobe here, it contains, it's showing us here, it contains 5 lobules. This is one with all the tissue around it here. This is another one with all the tissue around it. This is another one, this is another, like that. Okay? So that's how it happens. And the drainage from efferent arteriole, it goes to peritubular capillaries or vasa recta, then go to cortical radiate vein or interlobular vein, then arcuate vein, interlobar vein, renal vein, and inferior vena cava. So that's how the drainage takes place. Okay, so now you remember kidney is made of a lot of smaller structures. The function unit of kidney is nephron. Okay, the function unit of kidney is nephron. We have 90 minutes. So, but if you take the kidney tissue, this is what you see. Sorry, this one, not this one. This one. So this is one pyramid. Okay, this is one pyramid. This is the apex. You see, this is apex. This is minor calyx. You see here? This is the minor calyx. Remember, this my kind of receiving all. So all the it is called. It has a cribriform apex. The apex has multiple small holes. Those are the opening of the collecting tubules that drain the urine. Okay, so that's why we say it has cribriform appearance. It has multiple holes appearance. Okay, so if you see the initial part, this area here, this is the real pyramid here. This is the medulla. This one here. Okay. So and then this is the cortex here. So this is the cortex here. So the cortex is the more outer part there. But because this is just around one pyramid here, so we cannot see the next pyramid clearly. But this is how what happened. And in the cortex, you see a lot of glomeruli. These are glomeruli, okay? The ones, the top of capillary that receive afferent arteriole and give rise to efferent arteriole. Okay? So you can see all these are nephrons. And in between nephrons, all these are tubules. So some of the tubules are proximal convoluted tubules, some are distal convoluted tubules. So now and then in the pyramid, it is made of a lot of collecting ducts, collecting tubules and duct system. Okay, less what do you call it? Nephrons. Okay, more of collect because that's the main function here. So let's see detail. So if you check here, this is just showing you. So this area here where there are a lot of tubes, we now know that this is pyramid, part of the pyramid or part of the medulla. You can say medulla. That's a lot of duct system here. You can see this are thin. Look at this one. This thin segment of loop of Henle. I'm not going to teach you the detail of each of them now because you're one. But it's suffice to mention that you need to know that when you see this, you know this is cortex. You can see multiple nephrons. These are nephrons. In between, these are proximal and these are convoluted tubule. You can see the proximal and convoluted tubule, they are smaller compared to the collecting duct. These are collecting tubules and duct system, the one that drain the urine. Finally, they are bigger than this one here. But you can also see that there are some there, like, okay, you can see the distal convoluted tubule is almost looking like this tube here, but it's smaller. While the pinkish is the proximal convoluted tubule. So you see, the distal is lighter, okay, and more somehow broad, okay. Of course, the remaining thing actually is all what we mentioned: proximal convoluted tubule here, distal convoluted tubule. You see, distal convoluted tubule is everywhere is lighter, okay, it's lighter here, and they look tubular. Okay, let's see more detail. So we have mentioned all this. Mention this. Okay, now this is bigger packet. So this just show you all the details. So this is Bowman's capsule. Okay, so these are tuft of capillary. Okay, glomerular capillary. All these are glomerular capillaries. And the space here is the Bowman's capsule. Okay, capsular space. The space here, capsular space. And this is the urinary pole of the nephron, or the proximal part of the nephron. And then the rest, you see, this is distal convoluted tubule. You see, this is, look at here. This is collecting duct. Collecting duct, I told you, they are much bigger. So this is collecting duct, but this one is distal convoluted tubule, and the rest are mainly proximal convoluted tubule. In this section, okay, depending on where you make the section. Okay, so if we move forward, this, okay, now this one here, where, okay, I have already labeled it. This is medulla, okay. So you can see here, we cannot see nephron, we cannot see any of them, but we can see a lot of ducts. So look at this one, this primary part, sorry, this is papillary duct, the big duct that drain urine. And this is straight ascending segment of distal tubule. Okay, and look at here, you can see capillaries. These are capillaries, this smaller one there, capillaries. Okay, so this is papillary ducts, and some of these are venous. This one is venous. This one is also venous. Okay, and this is the thin segment of the lobe of Henle. So once you look at the microscopic anatomy of the kidney, you can easily differentiate whether this is a cortex, whether this is a medulla, whether there are nephrons or there are no nephrons, which kind of duct is present, and so on. Very easy. Now here, this is medulla. How do you know it's medulla? At least now you know that this is the area where we have the cribriform plate, cribriform perforation, I mean. And now this one is the papillary, the biggest duct, which will drain urine there. So here it was cut oblique. This one, it was also cut transverse. But one thing is very obvious, we cannot see the nephrons here. Okay, because they are located mostly in the cortex or at the junction between cortex and medulla, juxta medullary cortex. Okay, any questions so far? Because I'm almost finished. Any question, please? Okay, so a bit detail. If you take one nephron, this is how it looks like. So you see that it's a nephron. It has proximal convoluted tubule. It has distal convoluted tubule. Okay. On average, each kidney contains 1 million nephrons. And in some patients with chronic renal disease, most of these nephrons will die. There are a lot of diseases that cause death of nephrons. So when the nephron, when the critical mass required for function is reached, then the kidney will fail, and then the patient will need dialysis, or and then later he or she will need kidney transplant. So based on that, I told you, based on the arrangement, the way the nephrons are arranged, we can have two types of nephrons. Okay, we can have cortical nephrons, those are situated in the cortex, and we have juxtaglomerular nephrons. Juxta, those ones that are around the medulla and cortex junction. Okay.
All right.
Did you say anything? Did you say anything? Did somebody ask a question?
Oh, no,
Okay.
not a question.
So if you take nephron, this is how nephron look like. It is made of renal corpuscle. This renal corpuscle contains capillaries. So all these are capillary network of capillaries. And they receive afferent arteriole, I told you last time, and efferent arteriole. In the case of kidney, we said it's coming from interlobular, interlobular artery. So the interlobular artery gives rise to multiple afferent arterioles to supply multiple nephrons. All the nephrons where the afferent arteriole from one interlobular duct reaches all their collection and the surrounding tissue is called one lobe of the kidney. Okay, I'm repeating so that you be clear, please. And look at here, this is the proximal convoluted tubule. Look at how it is, what do you call it? It looks tortuous. Then we have loop of Henle. So the loop of Henle has different parts. It's also different part. It has thin descending limb, okay, and then the lower limbs, they are also very thin, and then it has thick ascending limb, okay, and then it joins the distal convoluted tubule, okay. So you can see each area there are spectacular function it does. This should be covered in physiology. Okay, I used to cover it, but since we have Dr. Pfizer, I think it's her turn. I will allow her to cover all this. So this if each part you're supposed to know, like the program control, what are the things that happen there in terms of metabolism, in terms of excretion and secretion and reabsorption and so on. So you can see the reabsorption of water, ions, and all of that. So I think you do all the detailed with her. Okay. We have already discussed that. I will cover anatomy. Hey, where is the menu? So if you take more detail structurally, you see that the Bowman capsule inside is made of actually tuft of capillaries covered by certain cells. Okay, so some specialized cells. So this is how it looks like. So this is the afferent arteriole, this is the efferent arteriole, and all these are tuft of capillaries that bring in blood, and the blood is filtered. And you can see here, this is Bowman's parietal epithelium forming the Bowman's capsular space. So the urine or the filtered, ultra-filtered goes into this Bowman's space, and then it is passed to the proximal convoluted tubule, and then it passes into the tubule and processed. Okay. If you take capillary, the inner membrane or the inner layers is made of visceral epithelium, and those epithelium here, they are called podocytes. This one here, they're called podocytes. Okay. But here, this one, they are made of parietal cells. Okay. This one here, they are made of parietal cells. The outer. And of course, I mentioned the space here. And this capillary, they are specialized capillaries. Okay. Why? Because they filter molecules or content of the blood according to molecular weight. There are certain molecular it allows to pass the certain data. So it's specialized. Okay. Of course, I told you most of the physiology, Dr. Pfizer should talk about. Okay, if you take, before we leave, if you take each component of the tubule, you find that the epithelia are different. Okay, the epithelium is different. So look at what happened in the thin segment of the lobe of Henle. Look at the cell. The wall is made of simple squamous epithelium. Are you following? The wall is made of simple squamous epithelium. If you take the thick segment of the lobe of Henle, you see a simple cuboidal epithelium. If you take the capillary, look at it. You remember the capillary network? It's just very simple squamous epithelium. But you see, thin segment of the lobe of Henle has bigger and more number of simple squamous epithelium forming the wall. How about proximal and distal convoluted tubule? Look at proximal convoluted tubule here. The cells that form the wall, they are simple columnar epithelium. They look tall. You see, they are tall like. Okay, so I think I have mentioned all this here. Didn't we mention here? Okay, but supposed to also mention here, distal convoluted tubule, the cell here, they are low columnar. Okay, they look columnar, but not as tall as this one. Okay, but you see, they are not squamous. So this is very, very important. Okay, let's see. Okay, before we leave, I would like to mention this. Now look at this one here. This is distal convoluted tubule. If you take the afferent arteriole and efferent arteriole, at their junction, there are a group of cells there. Those cells, they are called juxtaglomerular cells. These are specialized cells. Okay, and the cell of distal convoluted tubule, or the distal convoluted actually touches this apparatus, this juxtaglomerular apparatus. The distal convoluted tubule, you see here, that is supposed to be draining urine into the tubule from the proximal complementary tubule, or from the loop of Henle to be precise. It is touching this group of cell here, and just the cell, the cell of the this complementary that touches this juxtaglomerular apparatus is called macula densa. Okay, so it's very important because this is where hormonal function of the kidney comes in. Okay, I think we didn't mention the. Okay, we mentioned here this juxtaglomerular cells. They are specialized multiple cell of the wall of the arterioles. They produce renin. Okay, so you can take this information. Okay, this just I think I mentioned all this. Just read about all this. I put a lot of information. Okay, read all this. They are simple things. Okay, so I think so those are the I think important information. Each section, each segment of the tubule, you need to know which kind of cell is there, what is their function. Okay, whatever function is taking place there is a reflection of the type of cell found there. For instance, where you have the simple squamous, you know the absorption will be much easier because the wall of the cell is very small. But when we have a simple columnar epithelium, absorption can be a bit harder, but it can take place through different mechanisms. Okay, any question, please, so far? Any question? Any question? You're all quiet. Is it understood? Is it understood?
Oh, mostly yes, doctor.
Okay, that's great. Okay, so I think I will stop here. Whatever I haven't mentioned, I think Dr. Pfizer will cover it with you in the next few minutes. He will join you. Okay. If you have question later, you can ask me through WhatsApp.
Okay.
Yes. Thank you very much.
Thank you so
Thank
much.
you, doctor.
Thank you, doctor.
Doctor.
Thank you, doctor.